Good day, my name is Dr. Reynolds, Bill Reynolds. I'm a plastic and reconstructive surgeon. I'd like to talk to you today briefly about some basic considerations for breast augmentation. Probably the most important question that women will be asking is, do you place this above or below the muscle? The muscle that we're talking about is the Pectoralis Major muscle. It's a very flat muscle. It inserts on the rib cage, the sternum, the clavicle up here, which is the collarbone. It's a very fan-shaped muscle that attaches to the arm, and it's important for your skiing and such things. And what we do is we place the implant below that muscle, or we place it above the muscle. The decision to place it above or below the muscle is dependent upon so many things: the anatomy, what the patient's desires are we using saline, are we using silicone? And the various options for doing it are extensive, again, depending on anatomy, physiology, and what the patient's desires are. Imagine a woman is as flat as that wall. That woman is probably better to place any implant underneath the muscle, especially if it's a saline implant. The reason for that is, if you place a saline implant above the muscle, then the partner or the patient can actually see or feel the edge of the implant. So if a woman likes to wear a bikini or a low-cut evening gown, it would probably be seen or felt. However, if you place it below the muscle, then to feel it, you would have to feel through the different layers, which would include the skin, the subcutaneous tissue, and the muscle. It's a much better solution. Patients who would put it above the muscle are usually patients who already have substantial breast tissue who could cover the implant. For example, if a woman is already a size C and she just wants to augment herself to something like a large C or a D, she would have sufficient breast tissue to place the tissue above the muscle and still hide it so no one can see it or feel it.